With cytotoxic contamination in the wards, there's lots of policies and directives to protect pharmacists, and they've done a wonderful job at this. But there's very little evidence out there or guidance out there, in particular with regards to legislation, for what we can actually do for nurses. Now, nurses are exposed to cytotoxic drugs all of the time, whether that be administering them, whether that be in some countries preparing them. Equally, nurses care for patients that have received cytotoxic drugs, whether that be providing basic, essential elements of nursing care such as feeding, washing, personal hygiene, toileting. They're constantly being exposed to cytotoxic waste, and we don't know what the long-term effects are. There's some evidence out there to suggest that nurses might be at increased risk of spontaneous abortion when they're pregnant and care for patients receiving cytotoxics. There's equally evidence out there to suggest that some nursing staff might be at increased risk of going on to develop cancer themselves for the amount of cytotoxics that they're exposed to. So we need robust guidelines and legislation to ensure that we are protecting the cancer nursing community that care for patients receiving chemotherapy. Personal protective equipment is a given, and what we need to ensure is that we've got robust legislation to ensure that nurses have access to the same standards of personal protective equipment, such as the correct use of gloves, gowns, protection for the arms, and whether or not we need to actually be employing other measures such as wear of face masks, eye protection, and ensure that we've got access to testing in the clinical environments to ensure that we know what levels of cytotoxics are on the different surfaces in the clinical area. EONS, amazing organisation that I'm very proud to belong to. Our safety manifesto, this is one of our key aspects that we're looking into, and we're working with other organisations including ECHO and ESOP to ensure that the nurses are at the table now, and we are actually helping to drive policy so that we have robust legislation across Europe to ensure that our nurses are protected.